I'd like to talk to you about cold lasers. Cold lasers are one of the coolest things that I ever got to see and use in my practice. Cold lasers have been around for about 40 years, but used practically in healthcare for maybe the last 15 or 20 years, and their use is going up and up. A little bit about cold lasers. The reason they're called cold is because the beam never gets hot enough to cause any burning. In fact, the reason that cold lasers are so effective is because they almost have a homeopathic effect. The thing that they do is, and particularly this one, I'm going to turn this one on so you can see, and I'll shine it on my hand here. This particular red light in this laser is 635 nanometers. That's the wavelength of the light. And it's at 5 milliwatts, which is a very, very low intensity. The lower the intensity, the stronger the effect. Now, the wavelength has an effect on DNA in cells. Normal cells, when they divide to make two new cells, when the DNA splits, if you remember your meiosis and mitosis from biology, there's a burst of light that comes out of the cell. When the cell is nice and healthy, the wavelength will be right around 635 nanometers. If the cell is damaged or sick, the wavelength will deviate high or low. So the way these things work is that when you shine that nice low intensity 635 nanometer beam at a cell, the cell will start to vibrate along with the laser. So if it's off, if it's too high, or if it's too low, it's going to start to vibrate at the right wavelength. There are a lot of uses for this type of technology. From pain relief to restoring nerve function to healing skin, and I have seen miraculous cures with a laser. Many times in my career I've lasered somebody who has a scar. I had a patient who had a scar on her arm for 30 years, lasered it one time for 2 minutes, and the next day it was basically invisible. That's an extreme positive result. Sometimes you have to do it over and over again, lots of times. But I've done that a few times, just a one-shot deal. And that's how fast that healing can take place. We use it a lot to turn on nerves. The first time I saw a laser demonstrated, they were lasering a young boy who had severed the nerves in his neck going to his arm. His arm had been paralyzed for 6 months. He couldn't move it at all. After having his neck and arm lasered for 15 minutes, his arm started to move. And that is absolutely a miracle. In our office, we have about 7 different lasers that we use for different things, from restoring nerve function to killing bacteria and viruses. We use a violet laser for that, which is similar to ultraviolet light. That's 405 nanometers. We have lasers that we imprint frequencies in. We use that for allergy desensitization, and we also have a laser that makes your fat cells open up and can actually help you with fat loss. So we can actually laser somebody's spine to help turn on all the nerves in the spine. We can laser different parts of the brain. We could do a plexus of nerves in the neck. We can do one specific muscle, triceps muscle, or a group of muscles if we find that those are not functioning properly or we have lack of strength. We can actually do specific nerves and that would be associated with hearing or eye function. And one of the things to remember is this never gets hot. I could laser this for hours and I'd never feel it. And actually, it's always cool, but you can feel the vibration. It feels like wind just hitting my skin there. So it's extremely safe and it's very effective. And if I had one thing, if I was on a deserted island and I could have one healing tool, it'd be a cold laser.